I'm Dr. Robert Perkins of the Ontario Critical Incident Stress Foundation. I'm here today to talk to you about critical incident stress management and critical incident stress debriefing. What's the difference between the two and how are they related? Critical incident stress management is a very comprehensive, systematic, multi-component approach, and it's part of a wider spectrum of what's known as crisis intervention. Within the scope of crisis intervention, there are many tactics and strategies, and critical incident stress management is one of those tactics. Within the spectrum of critical incident stress management, there are also many tactics and elements that are used. And one of the tactics within critical incident stress management is something called critical incident stress debriefing, also known as CISD. Critical incident stress debriefing is a very structured intervention that's designed to help people that have been exposed to a traumatic event, which we also call a critical incident, and help mitigate the emotional, physiological, and mental impact that that trauma has had on the individual. When people are exposed to trauma, they will be impacted, and they will be impacted psychologically, physiologically, and emotionally. And so what critical incident stress debriefing does is it takes healthy, normal people that were exposed to a traumatic event, and it helps them establish normalcy faster than if they hadn't had that type of intervention. And so a debriefing generally occurs within 24 to 72 hours after a traumatic event. And what it does is it allows these people to get back to normal functioning in their lives. It doesn't erase the event. It doesn't take away the symptoms of the event. But what it does do is it stops those symptoms, both physical, emotional, and mental, from paralyzing them in being able to function properly at their jobs and in their personal lives. The way that it works is there's a 16-hour certification course in which people will participate in both in-class instruction and using the skills that they've been trained in mock scenarios. After successful completion of the training, a written and a practical exam, those individuals will be certified by the Ontario Critical Incident Stress Foundation as certified critical incident stress debriefers. Critical incident stress debriefing is not a cure. It's not a form of therapy. It's not psychotherapy. It does have many elements of therapy within it, but those are secondary. It's not the primary function of critical incident stress debriefing. Critical incident stress debriefing's primary function is not to prevent post-traumatic stress disorder. Does it prevent post-traumatic stress disorder? Yes, it may very well, but that's not the primary reason for it. It's a secondary reason. So a primary reason, an example would be, for example, if you quit smoking, you're going to have an immediate effect. You're going to be healthier. A secondary factor might be, if you do these things, then this might not happen. And so any sort of prevention of post-traumatic stress disorder with critical incident stress debriefing is a secondary effect and not a primary effect. Again, the purpose of critical incident stress debriefing is to take normal, healthy people that have been exposed to a traumatic incident and bring them back to a more normal situation, which allows them to function the way that they were before the incident happened, both in the workplace and at their home. If you have any other questions about critical incident stress debriefing and how the Ontario Critical Incident Stress Foundation can help your organization, please visit our website at www.ocisf.org.